Vaping can cause serious harm to your lungs and your family by exposing them to harmful chemicals and oils. Here are some of the effects of vaping on the lungs. Vaping can cause DNA damage, which means that the cells in your lungs can mutate and become cancerous. Some of the chemicals that can cause DNA damage are acetaldehyde, formaldehyde, and diacetyl. Vaping can cause popcorn lung, which is a form of lung disease that scars and blocks the smallest airways of the lungs. This makes it hard to breathe and can lead to chronic cough, wheezing, and shortness of breath. Popcorn lung is caused by diacetyl and other chemicals that are used to flavor e-liquids. Vaping can cause lipoid pneumonia, which is a rare condition that occurs when oil or fat enters the lungs. This can cause inflammation, infection, and lung damage. Lipoid pneumonia can be caused by the oils that are used as bases or additives in e-liquids. Vaping can cause collapsed lung, which is when air leaks into the space between the lung and the chest wall. This can cause severe chest pain, difficulty breathing, and low blood pressure. Collapsed lung can be caused by the pressure or trauma from vaping devices or by lung damage from vaping chemicals. Vaping can cause lung cancer, which is when abnormal cells grow uncontrollably in the lungs and spread to other parts of the body. Lung cancer can cause coughing, chest pain, weight loss, and fatigue. Lung cancer can be caused by the carcinogens that are present in e-liquids, such as formaldehyde, acetaldehyde, and acrolein. Vaping can also affect your family by exposing them to secondhand vapor, which contains nicotine, chemicals, and metals that can harm their health. Secondhand vapor can increase the risk of asthma, allergies, respiratory infections, and heart disease in children and adults. Vaping is not a safe alternative to smoking. It can damage your lungs and your family's health in many ways. If you vape, you should quit as soon as possible. There are many resources and treatments available to help you quit vaping. You can talk to your doctor or call 1-800-QUIT-NOW for free support. Vaping can also affect your immune system, making you more susceptible to pneumonia and other infections. Here are some of the ways that vaping can harm your lungs and weaken your immunity. Vaping exposes your lungs to chemicals that can cause inflammation and damage to the lung tissue. These chemicals include acetaldehyde, formaldehyde, diacetyl, and acrolein, which are known to increase the risk of lung cancer. Vaping can also cause lipoid pneumonia, a rare condition that occurs when oily substances from e-liquids enter the lungs and trigger an inflammatory response. Symptoms of lipoid pneumonia include chronic cough, shortness of breath, and coughing up blood or blood-tinged mucus. Vaping may increase the levels of platelet-activating factor receptor, PFR, in the cells lining the respiratory airways. PFR is a receptor that binds to pneumococcal bacteria, which are the main cause of pneumonia. By increasing PFR levels, vaping may make it easier for these bacteria to infect the lungs. Vaping may disrupt the normal function of immune cells in the lungs, such as macrophages and neutrophils. These cells are responsible for clearing pathogens and debris from the airways. A study in mice found that vaping reduced the ability of these cells to fight influenza virus infection. Vaping may also trigger hypersensitivity pneumonitis, an immune reaction to an unknown environmental antigen. This condition can cause fever, cough, chest pain, and difficulty breathing. It can also lead to chronic lung disease if left untreated. As you can see, vaping can have serious consequences for your lung health and your immune system. By vaping, you are putting yourself and your family at risk of developing pneumonia and other respiratory infections that can be life-threatening. If you want to protect your lungs and your loved ones, you should quit vaping as soon as possible. Vaping can harm not only your lungs, but also your heart, brain, blood vessels, and oral health. Here are some of the ways that vaping can damage these vital organs and systems. Vaping can impair the function of the body's blood vessels, increasing the risk for cardiovascular disease. Blood from people who use e-cigarettes can cause more permeability and less nitric oxide production in the blood vessel cells than the blood of non-users. These factors can make the vessels leaky and impair their ability to dilate and relax, which can lead to high blood pressure, atherosclerosis, and heart attacks. Vaping can also affect the brain, especially in young people whose brains are still developing. Nicotine, the addictive substance in e-cigarettes, can alter brain chemistry and affect memory, attention, learning, and mood. Nicotine can also increase the risk of addiction to other substances and impair brain development in adolescence. Vaping can damage the lungs by exposing them to toxic chemicals that are produced by the heating of e-liquid or by additives in the liquid itself. These chemicals can cause inflammation, oxidative stress, and lung injury, which can lead to chronic obstructive pulmonary disease, COPD, asthma, bronchitis, and pneumonia. Some of these chemicals, such as vitamin E acetate, have been linked to a severe lung condition called e-cigarette or vaping use-associated lung injury, EVALI, which can cause shortness of breath, chest pain, coughing, and even death. Vaping can also harm oral health by increasing the risk of gum disease, tooth decay, and oral cancer. E-cigarettes can dry out the mouth, reduce saliva production, and alter the oral microbiome, which can create a favorable environment for bacteria and plaque to grow. E-cigarettes can also contain carcinogens and metals that can damage the oral tissues and DNA, leading to oral cancer.